Medical Center recently opened a high-risk breast clinic that provides support to patients who are higher risk for breast cancer. Today for Health U, we are joined by Laura Nielsen, nurse navigator for Lexington Medical Center, and we're so excited to talk more about this and learn more about this clinic. So thanks for joining us.
Thank you.
Let's start with what the high-risk breast clinic is. What is it?
High-risk breast clinic provides support to women who are at higher risk for breast cancer. We do this through more frequent screening, more observation, and other risk-reducing strategies that we talk with the patients about. I can help you navigate your treatment plan at no extra cost, which means I can help you understand your diagnosis and treatment. I can help schedule appointments, help schedule tests, help you come up with questions that you want to ask your doctor so that you can understand your treatment better, and I can help you understand those explanations. And I'm always available for emotional support, so if you need to talk about anything, just give me a holler. Right now, current guidelines say anybody who's at average risk, 40 years old to when you're 74, every 2 years to have a mammogram. But it's important that you talk with your doctor to make sure that that's the correct screening tool for you, because with your risk of breast cancer being higher, it might be different. How do you know you're at high risk? Well, at your mammogram, you may fill out a questionnaire. The questionnaire is talking about or asking about risk factors for breast cancer. So once you give those responses, the questionnaire will calculate your % lifetime chance for getting breast cancer. If you're at 20% or greater, you are considered at high risk, and you would qualify to be followed by our high-risk breast clinic.
And when they do this questionnaire, is that questionnaire done by their primary doctor or during that mammogram appointment with their primary doctor?
They'll either have done it on a MyChart or they'll have a tablet there that they can fill it out on.
And what are the next steps after learning that you're high risk?
You may get referred to a genetics counselor, depending on your family history of cancer. At that appointment, the genetic counselor would do an in-depth review of your family cancer history, and you could qualify for genetic testing at that point. The genetic testing would tell you whether or not you had any gene changes that would make you more at risk for breast cancer. Also, you might get a referral to a medical cancer doctor, also called an oncologist, to discuss any kind of preventative hormonal therapy that would come in a pill form. And this medicine helps make it harder for cancer to grow. So that would be a consult as well. Also, your doctor may talk to you about any kind of surgical options you would have for breast cancer risk reduction. There are several things you have no control over that can make you at higher risk for breast cancer. This is stuff that's asked on the questionnaire. Your age, the age when you had your first menstrual period, the age you had your first child, your family history of breast cancer, and any breast cancer gene mutations you may have. There are also things that you can control that can help decrease your risk for breast cancer. Having a healthy weight is helpful for a lot of things, especially after menopause. That can help you decrease your risk for breast cancer. Consistent exercise has been shown to decrease breast cancer risk, as breastfeeding, having children at a younger age, and limiting or avoiding alcohol. All of those can help decrease your risk.
All right, well, Laura, thank you.